we are looking at a topic I call how to know you are ovulating or not, or not. Now the truth is that for the lot of women, they are not ovulating and they do not know they are not ovulating, and they keep having sex with their husband with the hope that they are going to get pregnant, but they are not ovulating. Now, it will amaze you, it will dazzle you to note that even in women who do ovulation tracking, who use the ovulation prediction kits, a lot of them, there is a surge in the luteinizing hormone, and the kit registers it as positive, but yet they are not ovulating. For example, in the case of PCOS. And also, there are many cases whereby women are shedding blood. They see their menstrual blood every month, but still they are not menstruating, they are not ovulating. And this is why we are here today to look at these instances of cases where somebody might be ovulating and might be menstruating, but is not ovulating. And there are quite a number of them. You see, it can be very frustrating for you to think that you are ovulating, but you are not ovulating. And at the end of your cycle, you are expecting to miss a period with the intent or with the belief that you are pregnant, and you see another period again. So we want to look at what you can do. We also look at what you can do to be able to overcome this hidden problem, because it is hidden in many people. Now, there are signs that will make you to know whether you are ovulating or that you are not ovulating. So when you see your period, and it is very irregular, it is irregular from month to month, or altogether, sometimes it is missing, that you don't see it at all, then it is probably will raise the suspicion that whether you are ovulating or you are not ovulating. Number two, the cervical mucus. It is the normal physiological response of the body when you ovulate. At that time, your body, your vagina is as a mucus, as mucus secretion that will prepare you for sex at that time for you to be able to conceive. But the truth is that during that time, if you are not ovulating, you might not see the cervical mucus. So what you see is a dry kind of mucus. It's not the real slimy mucus that will support, good sex and fertilization. And that is another one. Now, talking about another sign that will make you not to be, when you are ovulating, for you not to be able to, for when you are menstruating, for you not to know that you are ovulating, is that there will be no rise in basal body temperature. Everything will just be calm. There are no changes at all. Normally, when the hormones are circulating, when the hormones are at their peak levels during ovulation, you are supposed to see certain changes. Some people see cramps, they notice cramps, breast tenderness, and things like that. But when you're actually not ovulating, you don't see things like that. Then also, in some women, when you try to use the ovulation prediction kits, you discover that there is nothing. You don't see anything when you use the ovulation prediction kits. So it's another sign. But you remember I told you that it is possible for a group of women to see positive, to see that the ovulation prediction kit reads positive, but yet they are not ovulating. And those are the things we are going to look at. Another thing is that the Mittelschmerz pain, the mid-cycle pain, will not be there, because the hormonal changes are not significant enough to cause this pain. And generally, if you have been trying to conceive for like 6 months to 1 year and it has been difficult, everything seems normal, you are menstruating, everything seems normal, but you are still not unable to conceive, then you need to suspect if you are ovulating. And at the end of this video, we are going to see how you can be sure, how you can be double sure that you are ovulating, how you can be double sure. Now, another, you see, there are reasons why a woman might not ovulate, even though she's menstruating, she's seeing blood, she's happy that I'm menstruating. There are reasons why she might not be ovulating. Now, there are conditions, underlying conditions that may deny her that ovulation. And number one, first and foremost of it, is the polycystic ovary syndrome. The polycystic ovary syndrome is a stubborn syndrome, and it's usually very gentle, very quiet, that you might not really know that anything is happening. And the funny part of it is that you will even use the ovulation prediction kit. It will show that it is positive, but it's a lie. You have not ovulated. So one of those cases is the polycystic ovary syndrome. And if you have been trying to conceive for long, it is one of those things. You see, it is one of those things that you check. They are very hidden. Number two that is hidden is a blocked fallopian tube. So those ones are very quiet, very hidden. So if you are trying to conceive and it has taken long and everything seems normal, so those two things, polycystic ovary syndrome and a blocked fallopian tube, you've got to check those ones. Another thing that will make you to menstruate without ovulating is premenopause. When you are close to menopause, and in some people it is quicker. In some people it is just about 35 years. They are just about 35 years old, and they are noticing it that there are signs of premenopause. Now they see that they cannot sleep very well. Sometimes they feel feverish, they lose appetite, and all those things begin to happen to them. So the signs of premenopause: vaginal dryness and hot flashes. All these things are signs of the premenopause. Now, another thing is that the thyroid hormones, when the thyroid hormone is low, hypothyroidism might make you to actually menstruate but not ovulate. Another one is high stress levels, emotional stress. When you have a lot of emotional stress, for a woman, for example, you live very far, you travel from where you live to work, and when you get to work, you do tedious job. You see that, so that when you get home, you are already tired, you are already worn out. In people like that, they might discover that they are menstruating, but they are not ovulating. So you need to reduce the level of your stress. Now, another thing is that if intentionally you exercise too much, it's not good to exercise. Now, to exercise excessively, it is good to exercise on a daily basis. It is good for fertility. It is good for your reproductive health. But if you do it it is too strenuous, then it will affect your ovulation. It might cause you not to be able to ovulate. Now, another thing is a premature ovary insufficiency. All of a sudden, the ovary begins to develop problems that is unable to really produce eggs the way it's supposed to at an early age. Then another thing is high prolactin. When there's high prolactin, it suppresses the hormones, you see, and that is why you see that the menstruation might be irregular, or that there will be missed menstruation, that a woman might not even menstruate at all. So, for example, and it has been shown that there are certain things that may cause the level, that may cause this prolactin to increase. When there's high prolactin in a woman, there are certain things that will make it to increase. And some people said that when couples like sucking breast, or they like playing with the nipples, that it increases the secretion of prolactin and suppresses the ability to be able to, to menstruate normally and to ovulate normally. So, and this is true. So, and you need to watch it. If you are a couple and you are trying to conceive, you need to watch your sexual habits. You need to watch your sexual habits in that direction, so that you will not, so that it will not affect you, so that it will not affect your menstruation and your ovulation. Now, let us look at conditions. There are certain conditions. I told you, and it is possible for a woman actually to have a surge in luteinizing hormone during ovulation, and you think that all is well. You think that all is well, and that is why a lot of women, after ovulating, they tested, they saw that yes, I ovulated. The ovulation prediction kits said positive, but now I'm not pregnant. What is happening? And that is the reason. Many of them did not actually ovulate, although there was a surge in the luteinizing hormone levels, and that is why they didn't. And under that circumstance, they did not ovulate, even though there was a surge. And what could cause that? One of it is the polycystic ovary syndrome. In the polycystic ovary syndrome, the egg is not released, even though there was a surge in the hormone. It was noticed, but the egg was not released. And if the egg is not released, there is no how that you can conceive. So polycystic ovary syndrome is one of those things that you will have that will make you to menstruate but not ovulate. It may make you to menstruate but not ovulate. Another one again is very low body weight. If your body weight is very low, you have a body mass index that is lower than 18, it can make you not to ovulate. And how do you calculate the body mass index? It is the weight, the body weight. You measure your body weight on a scale and you divide it, your body weight in kilograms, you divide it by your height in meters squared. And when you get that, it should really be between 18.5 and around 24.9. And that is optimal for reproduction. If it is not, if it is outside that, if it is lower than 18.5 or higher than 24.9, then it means you need to be very careful. It means you need to work on it, you see. And a reduction in weight, like as 5% or 10% of your weight previously, could actually make you to begin to ovulate and to menstruate regularly again. So weight is one of those things that you need to consider if you are looking for if you want to ovulate and to menstruate normally. Another thing that can cause that is again, high prolactin can cause it. Then hypothyroidism can also cause it. For you to see your menstruation, and for you and you are seeing your menstruation but there's no ovulation. And medications can cause it as well. There are some medications like antipsychotics, like antihypertensives. When you are using this kind of medication, it affects your ability to be able to ovulate and your ability to be able to menstruate. So they work on the hormones and they affect the hormones, like also the premature ovarian insufficiency too. So those conditions, they will make a woman to ovulate and to menstruate and not to ovulate, and you need to watch it. Now, so how do they now test it? How do they now know whether you are ovulating? Because it's a big problem now. Because many people, when you have all these signs and symptoms that I've talked about, then you need to check it to be sure that you are ovulating, to be very sure that you are ovulating. How can you be sure that you are ovulating? Now, there's a mid-luteal phase serum progesterone test, mid-luteal phase, that is about a week after the after the ovulation, if they check your progesterone, it's supposed to have risen if there was ovulation, because there will be the corpus luteum, that is the follicle that releases an egg, remains as a corpus luteum, and the function of the corpus luteum is to secrete progesterone. And if they measure the progesterone after a week that you have ovulated, it will show if you have ovulated or not, because the progesterone level will rise, because the corpus luteum will secrete progesterone. But if not, if you have not ovulated, there will not be a rise in the progesterone level. It will usually be less than 5 nanograms ng per mil. But on the other hand, if you ovulate, if you have ovulated, it will be greater than 10 nanograms per mil. That is if you have ovulated. So anything that is less than that shows that you have not ovulated. And this is a good sign, very reliable sign, to show that you have not ovulated, especially if it has been consistent. All these things, you need to do it, you need to measure it and make it consistent. And this test is very cheap. Now, the second one that is not that cheap, that may be a bit more expensive, is for you to do a scan. Is for you to do a scan. And when you do a scan, a transvaginal scan, you will see that the follicles, you will actually time it to, you'll be able to see the development, the maturation of the follicles. And at the time of a release of the follicles, you'll be able to see that a follicle has, that the egg has actually been released from the follicle. But if this does not occur, you will see it very clearly and will be very glaring on the scan, because you test, like if you do it like a week apart, you'll be able to know, because you'll be able to, there is the follicle is supposed to rupture around you see the follicle that is supposed to rupture, you see that it has not ruptured, and you'll be able to know that there was no ovulation. So those two methods are reliable methods that you can use to know whether there is ovulation or not. The two methods are the mid luteal phase serum progesterone, and two, the scan, the follicle, the monitoring of the follicle through the transvaginal scan. Now, it might be expensive, but it is also reliable. Now, when it is seen that you have not been able to ovulate and it is consistent for some time, then you go to your fertility doctor to put you through, to help you to conduct some further tests. But I'm just going to talk about certain things that you need to note if you have not been able to ovulate, if you have done this test and it says you have not been ovulating. And like I told you earlier on, one of those things that causes it is polycystic ovary syndrome, that makes people not to ovulate, or that makes them to miss their ovulation or to make it irregular, And one of those things that you need to do is that, you see, the first thing is that to see your fertility doctor, and the options that are available to you. You have medications that induce the production of eggs, and that is clomid and letrozole. So those medications are used to stimulate the production of eggs. Now, another thing is that it should not be abused. Some people abuse it, and it is dangerous for you to abuse it. So generally, in people with polycystic ovary syndrome, they use letrozole and clomid to induce the production of the eggs, and it works very well. And some people even say that it brings about the production of, multiple eggs, that some people are able to have multiple births, like, twins, from the use of clomid and letrozole. Now, another thing is gonadotropins. Gonadotropins, as in the use of the follicle stimulating hormone and the luteinizing hormone to have a direct stimulating effect on the ovaries to be able to bring out the eggs. Now, another thing is HCG, human chorionic gonadotropin trigger shots. And that one is used a lot in fertility clinics when they are trying to do IVF. Now, so if somebody has polycystic ovary syndrome, for example, the medications, they will use medications, and this one is very common, but I tell you, don't abuse it. Clomid is common, is available everywhere, and in some countries, there are no restrictions to people who can buy these things off the counter. So you need to be very careful. You need to be very careful so that you don't overstimulate. There's hyperstimulation. And when you hyperstimulate, it is not good for you. So you have to be very careful. You really need to know, get to the root cause of what is causing your inability to ovulate. You need to get to the root cause of it and address it appropriately, not to overload your system with clomid or letrozole. Like many people already know the work of letrozole and clomid, so they overuse it, they abuse it. Don't hyperstimulate because it is dangerous. Now, one thing that is good in that happens in polycystic ovary syndrome is that there is increased insulin resistance. And the insulin is being secreted, but it's not really working the way it should. And that is why also metformin is something that is used, it's a medication that is used so that you can work, you can be able to control the insulin resistance. And when you do that, a lot of these women are able to menstruate, regularly again. They're able to menstruate, they're able to ovulate and regularly. So medications are there for you to use. Then if there's hypothyroidism, then you use drugs that are used to treat hypothyroidism. And when you get to your service provider, they will be able to give you, the appropriate things. Number 2 line of management is the lifestyle management. And I told you that when there are lifestyle approaches, that when you lose weight, that your weight helps you. When you minimize your weight gain, or you actually lose weight, it helps you in a reproductive sense, that you are able to really ovulate and to menstruate normally. So too much of weight is not good. Anything that is, let's say, above 30 kilograms per meter squared of the body mass index, when you have 30, optimally it's between 18.5 and 24.9. But when you begin to have something like 30, it's pretty too much. And you really need to begin to work on it. And God so good. So if you are able to bring down about 5 or 10% of your body weight, if, for example, you weigh 100 kilograms, you are able to shed about 10 kilograms or 5 kilograms, then that is good enough for you. And that might just make you to conceive. Another thing is exercise modification. You see, a lot of people don't know that there is exercise testing and prescription. You test people before you give them exercise. You test them. There are ways that the body responds to exercise. So people respond to exercises in different ways, based on different parameters, based on their body chemistry, based on their weight, based on their underlying problems, based on maybe, for example, arthritis, for example, heart condition. So the people need to really be tested, and the appropriate dosage of the exercise needs to be recommended. And when you are trying to exercise, there are 2 types of exercises. You have aerobic exercises and you have resisted exercises. And these are exercises that you need to do, you need to do in the right proportions, in the right with the right intensity. Now, the aerobic exercises are meant to be done on a daily basis, but the resisted exercises you just do about 2 or 3 times daily. And somebody who is, believing God for the fruit of the womb. Another thing is balanced diet. You need a balanced diet. You need a balanced diet, in the right quantities, in the right type of nutrients, carbohydrates, proteins, fats and oils, in the right proportions. In the right proportions, not that the carbohydrate is so much and that is what you eat all the time. You don't balance it with the right quantity of protein and fat and oils. So everything needs to be balanced. When this is not balanced, then it can cause problems. And we know that carbohydrates are not really good. They are not good for the health. When it is excessive, it is not good for your health, especially your reproductive health. It is not good for it. Then the fertility friendly diet. You need to fortify your diet with a lot of fruits, with a lot of vegetables, then with a lot of nuts, and with a lot of cereals. And all these things will help uh, your ovulation, will help you to ovulate normally again. And another thing is that you need to stop smoking. If you are smoking, you need to stop smoking. You need to stop drinking, because these have effects on your ovulation. As a matter of fact, smoking reduces the ovarian reserve and makes you to to get to menopause or premenopause very quickly. When you smoke, it is not good for your reproductive health. So you've got to watch that. Then you need to use your normal routine medications of vitamins, folic acid, supplements, generally inositol, omega-3, vitamin D. All these ones, you need to use them. Now, for a lot of people that are not ovulating, or if your ovulation is irregular and you have checked it, you have tested it, you have done the test and you see that it is irregular. Now, a good option that is available for you, if you that is available to you, is the intrauterine insemination, IUI, and also at the best, the IVF. The IVF is very good when you have problems with your ovulation. You see, they know how to retrieve these eggs. They know how to, to harvest these eggs. They know how to, to make the eggs of good quality. They know how to select the best type of eggs that will be fertilized or that will be fertilizable. Then they also know how to there is a new system now that they use even to help men who have low sperm counts. So intracytoplasmic sperm injection, ICSI. You see, that's a new thing now. They can just pick one healthy spermatozoa and inject it inside the egg, and that is super. That is banned, and you are sure you have a very healthy, embryo eventually. So, and that is it. So the assisted reproductive techniques, you need that one is very important. Then another line of management is the donor egg. Sometimes when you use your own egg, you can have a donor backup. You see, and you use eggs that are donated from other people, and that one too is another approach when you are very low, when you are not ovulating. So that is another approach when you are not ovulating. Now, another one is mind body therapy. There are stress reduction, acupuncture, counseling. So all these things, they are very, very, very important. They are very important, and you need to note it. So, and that is it. Beloved, by the grace of God, I published some books. Now, these books, Deliverance from Witchcraft in Children is one of them. Another one is Uncovering Hidden Potentials in Children. So these books are available when you go to my Amazon authors page, and you have a link to it on this video. Now, another one is Miracle Healing. Miracle Healing. So this for people who are believing God for healing. Another one is Deliverance of the Fetus. This is for people who are pregnant and they believe God for healing. Another one is Understanding and Managing Your Temperaments. Then yet another one, this one is the one that has application for many people, and this is Complete Deliverance from Witchcraft. Complete Deliverance from Witchcraft. And this book touches on every aspect of deliverance, 38 chapters. So try and get a copy of this book. God bless you in Jesus' name. Beloved, and that is it. So feel very free to send your questions and your comments to the chats, and make sure you subscribe and you share the videos. God bless you in Jesus' name. So we are going to end for today. God bless you. Have a great weekend.